This is Accra Physiotherapy Clinic. I'm Richard, a physiotherapist, and I'll be speaking to you today just about World Physio Day. So today is World Physio Day, and all physiotherapists around the world come together to talk about physiotherapy, the impact of physiotherapy on our healthcare. So for this year's theme, we talked about osteoarthritis. So we had a little talk in the morning with our patients to educate them on what osteoarthritis is, their causes, the predispositional factors, the treatment, and all that. All right, so we delve a little bit into what the physios do. So when a patient presents with osteoarthritis, the person has degeneration around the knee joint. So when that happens, the person will be having pain, joint stiffness, crepitus, which is a lot of crackling sounds in the knee. So when that happens, the physio comes in as a conservative management. So with the conservative management, we have the medication aspect and we have the physical aspect. So the physio handles the physical aspect. So the conservative management is with the medications. That is the pain medications that are given to the person. So the physio really targets the muscle around the joint. So that's the first line of the treatment. So we have to strengthen all the muscles around the knee. So when the person comes, we assist the person to find the person's functional level and what the person is able to do. And from that, we can develop an exercise program to suit the person. So we don't have one exercise that cuts across every problem the person has. So the kind of exercise we give depends on the person's level of fitness, the severity of the injury, and the stage at which the condition has gotten to. So we give usually we start with some bed exercises that the person do, and gradually we move into weight-bearing exercises. We also do a little bit of pain management. So we have heat therapy. So for the heat therapy, it is done to bring down the person's pain. So even in the olden days when we used to have pain, so you see your grandmother or those old people that you stay with, they put a little bit of hot water around the area just to bring down pain. And the truth is that heat really helps to bring down pain. So we also use heat in our treatment. So anytime that you put a heat over an area of pain, the heat helps to bring down the pain. But you should also be mindful of the stage. So we use ice together with the heat. So when do we use the ice and when do we use the heat? So we use the ice at the really acute stage. That's when the condition starts. So let's say someone bumps the head in the wall. So the person will see a swelling immediately after that. So for such a case, we go on with the ice because the thing just started. So if it's acute, you go in for the ice. And when it's prolonged or it's chronic, then you go in for the heat because the heat is used for chronic cases. So when the thing happens fresh and you use the heat, it will cause further swelling and further damage. So but when it's a chronic stage, then we go in with the heat. We also have other modalities that we use. We use ultrasound. The ultrasound helps with movement of fluids in the tissue. It also helps with the tissue repair all around. But the main thing that we use as treatment is the exercise. So we really stress on exercises and being active. So a patient with osteoarthritis has to be active because once you are idle, not moving your muscles and resting your muscles, the muscles become weaker, the joint becomes stiff. So you have to make sure that you move the joints and you exercise with the muscle.
And the Ghana Physiotherapy Association is part of this Confederation of Physiotherapists. Now, this World Physiotherapy Day has been set aside as a day for physiotherapists throughout the world to showcase ourselves, to showcase what we do to the public or for the public, to let them know who we are, what we are, and how we contribute to the lifestyle and to the well-being of the public in whatever area, whatever country, whatever region that we all live in. And each year, WCPT has a theme that we all propagate, we all profess, we all talk about throughout the world. And this year is osteoarthritis. And osteoarthritis is a condition that affects most of us through our lifetime. Maybe in our younger years, but more often in our older years. And this is what Accra Physiotherapy contributed to the worldwide discussion about arthritis. So we had a public lecture this morning, and we had a number of patients, we had public, we had friends that came, and we told them about arthritis. We discussed the risks, we discussed the causes of arthritis, we gave a little bit of anatomy about arthritis, how it affects the joints. We talked about the management of arthritis. Arthritis is from wear and tear, so it's not something that you can maybe prevent. It's not something that you can actually get rid of. The only way in which you treat arthritis, in which you resolve it, is through surgery. But in most cases, this is not what happens in the general public. Physiotherapy then contributes greatly to the management of osteoarthritis. So that is what today is all about. And in actual fact, there's a lot of activity going on. Ghana has been very, very instrumental and very proactive in providing a lot of information to the public. There's been derbers happening, there's been lectures, there's been talks, we've had radio shows, and what we are doing is trying to get the word out there to the public, not only about what we do, but also about this disease or this condition, which affects a lot of us, through our lifestyle, myself included. Arthritis, just a quick, one of our physios will actually talk about the what arthritis is. But one of the causes is it can come run through a family. So genetically, sometimes some families, everybody seems to have arthritis of the knee, the hip, the ankle, it depends. Wear and tear, so the type of lifestyle, the type of job that you do, repetitive straining, repetitive use of a joint can cause wear and tear, which leads to the arthritis. Our weight, sometimes our weight, especially in women, that can also contribute towards the amount of pressure that is on the joint as you're using the joint, especially in the knee and the hip particularly, and that can also lead to arthritis. Our posture, women are also a bit more prone to arthritis, I think, because we have this shape where the hips are a bit wider, and so there's a bit more pressure that is radiated down and into the inner part of the knee joint, and so you get wear and tear, which happens a little bit more in that area, that part of the joint. Also, injury. So you can have an accident, you can have an injury, you can twist your knee, your hip, you can have a fracture that goes in the joint. That can also propagate, and that can also be a factor that leads to developing arthritis. So these are some of the causes of arthritis. And in a lot of instances, age is also a factor. So of course, as you get older, just like you do with your car, the longer you use your car tire, the more it wears out. So, and the same with us. And more often than not, it is more common in the older, but we are finding that younger people are as well, because of our lifestyle these days. We are on the phones, our head is down, our thumbs are clicking away on the keyboards, and this causes arthritis in the thumbs, the neck. And then also long periods of sitting can also contribute towards the wear and tear that is happening. Our posture, the way we stand, the way we sit, you get kids carrying their bags, heavy bags on one shoulder. So all of that contributes towards arthritis. Okay, so some of the signs and symptoms of arthritis. Pain. Most of the time, people will come here because they have pain. So with the wear and tear that happens in the joint, you get inflammation. So the joint becomes inflamed. It swells. So you can have swelling around the joint. The joint can be red, can be warm and hot from the inflammation. It causes pain. You'll find that putting weight on it can increase the pain. You find that movement of the joint also increases the pain. So you might have decreased mobility in the joint. You'll have also that the muscles start to get weaker because it's difficult, it's painful, so you don't move it. you don't want to use the joint as much. It alters maybe the way that you're walking, sometimes the way that you lie. So using that joint becomes a little bit limited. So definitely pain, the swelling, increase in temperature at the joint. The sometimes you get crepitus. So as the joint wears and tears, you get a crackling that happens. You can hear the joint cracking when you walk on it or when you move it. The movement becomes less, and sometimes the muscle around it also is affected. So those are some of the signs that you get that indicates that there's something wrong with the joint. And then to confirm it, tests. So you can have tests to check about the inflammation, but the x-rays and MRIs will also identify the fact that you've got, you have a space usually between the bones in the joint, and the space will start getting narrower, or sometimes it disappears altogether. The covering on the joint wears away. So after a while, the bone moves on bone, and that is painful. So that is what causes a lot of the pain there. The options, as we say, is physiotherapy. Of course, with pain, there's medication. There's pain medication that can be used, anti-inflammatories that can be used to get that inflammation and the pain down. But ultimately, physiotherapy to help with. We use modalities and non-pain, non-medicine in terms of medication to try and relieve the pain as well. We use ice or heat. We use modalities, ultrasound. We have different things, TENS, that helps to relieve the pain. And then, of course, we look at making sure that you have the movement in the joint. We will look at the way that maybe you are walking, that is putting more stress on the joint. We will discuss a person's weight, person's posture, the way that they are moving. If their job involves them doing repetitive movement, we try and teach them how to change the way that they are moving, lifting, shifting around, positioning in the chair. And then, of course, strengthening exercises. Exercises is a big component of management of arthritis. And when we say exercise, we're not saying that we're going to send you out running and jumping and going to the gym and doing weights. No, we do it according to what the person is capable of doing. So after assessment, the strengthening exercises, it may just be sitting, moving the leg up and down, maybe moving the arm up and down, maybe using light weights, maybe using the stretchy resistant bands that we use. So we want to strengthen the exercise which supports the joint, around the joint. So we want to make sure that you don't lose the strength in that joint, and also making sure that you get the movement in the joint. Usually the joint is lubricated. We have fluid that lubricates the joint, and with arthritis and with age, that lubrication and that fluid tends to dry up as well, so you don't get as much fluid in there as you usually or normally would do.